Hello YouTube, I'm Dr. Fox. Today, I'm going to talk about how are the signs of labor. As you get nearer your due date, you can start looking out for the signs that you will soon go into labor. Some women notice that their baby has dropped farther down the pelvis, or the doctor sees changes in the cervix following a pelvic exam, but not all signs are physical. You may find yourself suddenly engaged in nest building, rushing around making sure everything is clean and ready. You may go into labor before 37 weeks of pregnancy, and this is known as preterm labor. If you think you have started labor and you are less than 37 weeks pregnant, you must call your doctor or midwife straight away, as premature babies have extra health risks and you need to be monitored by medical staff. Okay, you may wonder, how do you know that labor has begun? There are several signs, and if you learn about them well in advance, you will feel more relaxed and confident towards the end of your pregnancy. The four main signs that labor has started are that you are having strong, regular contractions, you can feel pain in your belly and lower back, bloody mucus comes out of your vagina, and your waters break. Next question, what happens when your waters break? Sometimes it's not easy to know if your waters have broken, partly because pregnant women often leak wee anyway. In some women, the waters come out as a slow, continuous trickle, and in others, it's a sudden gush of a large amount of liquid. Call your doctor to ask for advice if you are not sure, and let them know if there is any particular color or smell to the liquid. Although a lot of women go into labor soon after their waters break, this doesn't always happen. If it doesn't, doctors may want to induce labor as you're at higher risk of infection after your waters break. Okay, you may wonder, what do contractions feel like? A contraction is the process of your womb first tightening, then relaxing as your baby is pushed down towards the cervix. It can feel like a wave going through you or like extreme period pains. As you go into labor, your contractions will get longer, harder, more frequent, and probably more painful. You'll be able to feel the muscles tightening and relaxing if you put your hand on your belly. However, not all contractions mean you are going into labor. You may have something called Braxton Hicks contractions in the last weeks of your pregnancy, which are a sort of false alarm and are usually painless, although they might take your breath away. You can tell whether your contractions are forced labor or true labor by timing how long they last and how much time there is between them. If you are having true contractions, they will become more regular and more frequent, whereas Braxton Hicks contractions do not occur in any particular pattern and don't get stronger. They just go away after a while, especially if you change your position or activity. But it can often be difficult to know, so call your doctor or midwife if you are unsure. Okay, next question. Do you have to go straight to hospital then? My answer is not necessarily. You've gone into the latent phase of labor when your cervix becomes soft and thin, which can take hours or even days. So you'll probably be advised to stay at home for a little longer. But if you feel your baby is moving less than before, or there's any change in the color or smell of liquid or discharge coming out of your vagina, let the midwife or doctor know immediately, because you may need to go into hospital then. Also, check your temperature every 4 hours or so, and if it goes above 35.5 degrees Celsius, call the midwife or doctor. Don't have sex after your waters have broken, but you can safely have a bath or shower if you want. Then, what's the next stage? Your first contractions are stage 1, then you move on to stage 2, which is pushing. The delivery of the placenta after your baby is born is the final stage. Okay, thank you for watching. See you soon.